but are there any problems with any of these devices that you just explained?
Sometimes. If the patient does wear it, you're correct. It's easy and it's simple. Air gets into the cells of our body, and they require that air. But some people have problems with the mask. There are masks that just go over the nose. There are masks that go over the mouth and the nose. And people over the years have had some problems with them, so they have added a humidifier. Because if you're breathing in air that's forced and it's dry, you might get a sore throat. They've made the straps a little more pliant, a little more adjustable, so that the skin isn't irritated. They've also changed the continuous pressure on the machine. It was called CPAP, for continuous positive air pressure. They now have a BiPAP. What a BiPAP is 2 levels of pressure. A stronger pressure when you're breathing air in to keep the airway open, and then when you're exhaling, a lower pressure so it's not as uncomfortable, so that the air that you breathe, when the carbon dioxide and the other air has to be exhaled, it's not forced back in by the stronger pressure. Here's a picture of a man sleeping with a CPAP. You can see it's blowing room air into his nose. You could also see on his face, he's relaxed, he's content. Some masks have 2 small pillows that look like straws. They fit into each nostril. There are several types of masks, all of them providing pressurized airflow and keeping the airway open if it's ready to collapse. The important thing is they save lives. However, with your question, Joe, medical studies show that many people simply will not wear one, even with all the comfort advances of the past few years. So, the American Medical Sleep Association last February changed their recommendation. It used to be the gold standard was a mask. They now state that for the sleep apnea patients who won't wear the mask, the new gold standard for mild to moderate obstructive sleep apnea is an oral appliance. I saw a funny thing on The Tonight Show a while back. You know the Jay Leno bit, headlines, where a misspelling completely alters the intent of the written word, and then we laugh? Well, Jay Leno was showing an ad that was obviously written by someone who provides a service to those patients who won't wear the mask. The ad was supposed to say, if you are intolerant to CPAP, there is an alternative. CPAP is CPAP. But instead, the newspaper erroneously typed, if you are intolerant to crap, there is an alternative.
Yeah, that is a good segment on that show. But seriously now, is there something else besides that mask that a person can wear to actually cure apnea?
Oh, no, Joe. No, absolutely not. The mask does not cure it. An oral appliance does not cure it. They both control it, so you don't have tissue collapse. They can both make you healthier, happier, and live longer, but neither of them will fix the problem. It's just like these glasses. They don't cure my vision. They control it, but only if I use them. If I wore these 24/7 for 10 straight years, the moment I took them off again, I'd have blurry vision while I was trying to read. Same with the mask or the oral appliance. The apnea patient needs to wear the therapeutic device, mask or appliance, every night, forever. You take the glasses off, you take the mask off, you take the mouthpiece out, and the problem is still there. Now, sometimes surgery can cure the problem. Basically, surgery is you go in, you rotor-rooter out the airway, and you make it open. That can cure it. But if the surgery is a little too aggressive, it can cause some problems, and it's painful. So a lot of people don't opt for the surgery. And when it works, it's great, but sometimes it doesn't work.
Is that almost like a liposuction, taking fat tissue out?
Not really, because you can take fatty tissue out of your belly, but here in the airway, there's cartilage. And if you try to do liposuction of the fat between the cartilaginous areas, you would destroy the airway. So you can't do liposuction. Very good question, though.
So, Dr. Klein, it sounds like the surgical method almost would be a last-ditch effort to help you. One of the simpler ones to me sounds like this mouthpiece or the oral application piece you were talking about.
Oral surgery is not really a last-ditch effort. Many people don't want to wear the mask or an oral appliance and want it controlled, and for those is an option. However, the oral appliances are used in the mouth during sleep to prevent the oropharyngeal area, or the back of the mouth tissue, as well as the tongue tissues, from collapsing into and upon itself, obstructing the upper airway, which is why it's called obstructive sleep apnea. There are 10 million people in the United States each year with asthma. There are 16 million people with diabetes, and there are 12 million with diagnosed sleep apnea. So think of it this way. When you consider, like we talked about before, that apnea limits the amount of oxygen to every part of our body, it's conceivable to easily understand that some of the diabetes, some of the asthma, might not be there if the person were sleeping normally. So you kind of wonder about these statistics. These diseases or disorders, they can occur or get so bad because of sleep problems. Maybe with good sleep, you're not going to have as much asthma or as much diabetes.
Remember, always ask your doctor so we can maintain a healthy community. I'm Joe Sturza. Thanks for watching Ask the Doctor.
If you would like to learn more about how to sleep better, go to Dr. Klein's website at www.sleepapneamichigan.com. Watch other Ask the Doctor videos with Dr. Richard Klein to learn how to sleep more comfortably.